aesthetics should be considered part of dentistry as a whole instead of just a specialty. Regardless of our expertise, a common goal in dentistry will always be to integrate, preserve, and or recreate function, biology, structure, and aesthetics. Therefore, there is no dentistry without aesthetics and no facial aesthetic without dentistry. Welcome everyone to the whole new horizon of facial aesthetic that will take you and your patient into a new dimension. Dentistry has evolved since the very beginning from simple dental care to the present moment with the latest development, innovation, and advancement. We are now into the digital world of dentistry and giving our patients the ultimate dental care that dental science can ever offer. We have done everything within the oral cavity with excellent and optimal result for our patient. So what else could we do in this modern era? For so many years, dentists have been looking and concentrating only in, around, and inside the oral cavity. We have never set our eyes way beyond these areas. And probably we did not or did not. And we are not aware that we have learned in details the facial musculature, bony structure, and skin from the neck upward. Today, I would like to share with you another aspect of our therapy and perhaps use our expertise to add another treatment procedure for our patient. We shall now venture beyond the orbicularis oris. Um, According to this plastic surgeon, Ivo Pitanguy, he says, before performing facial plastic surgery, we should first take care of the smile. He says, a smile works as a postcard of ourselves, a unique expression that is only to human beings. So in order to produce an aesthetic smile, we should first understand the face itself. There is a lack of facial knowledge by dental surgeon and a lack of knowledge of smile by plastic surgeon. This gap should not exist. So the integration of these two whole will transform the way we impact people's life by modifying their facial expressions. According to Professor Anno Klein, University of California, he says dentists can provide the most comprehensive diagnosis for lips and oral facial augmentation. They say while dermatologic and aesthetic journals deal with substances for implantation, these journals do not in itself hold any information regarding the proper measurements, the proper goals of lip enhancements, for example, where only dentists knows best. So instead, these answers can only be found in the dental literature, where many articles have addressed the proper height, size, and location of lip as produced by the dental restorations. Another professor, Sandra, he says botulinum toxin or Botox, one of the botulinum toxin drug derived from this bacterium, botulinum toxin, botulinum has gained popularity over the past 30 years as a safe, non-invasive cosmetic treatment for facial lines and wrinkles. But it has a rich history in treating a wide and eclectic group of medical and dental maladies and conditions. So why are we dentists involved into this facial aesthetic and beyond? Why not? It is within the context of dentistry where we can provide these tremendous and hot treatment modalities and what these enhancement products can do for you and your patients. It will give you the opportunity to learn something new and exciting. It will give you the additional care and service that you can provide to your patient. You will recognize your practical application of these treatment procedures. And of course, as dentists, you can tap into our creative outlet and also for our professional growth. And lastly, it gives you an additional financial success. Why dentists? Because we are expert in the oral and facial area. We are expert in the oral facial anesthesia and injection techniques. If you agree with me, we give more injection than anyone else. we are technically precise, and we are able to provide a total facial aesthetic in complement what we are done or doing inside the oral cavity. It is in line with our minimally invasive philosophy. And as I said earlier, dentists are generally artistic and creative. It complements our overall aesthetic and functional aspect of our treatment planning. And dentists are very unique because we have our existing recall or recare system. We call back our patients over few months, for the checkup and so on. And as most of the time, our patients develop a kind of a long-term trusting relationships. So this is the next level in the therapeutic and cosmetic dentistry that we will I'd like to share with you. Time magazine in January 16, 2016 says that Botox has become the drug that treats everything. There are about 793 problems or conditions where Botox are very useful. Bloomberg next in the following year says Botox is the most lucrative, poisonous, and secret formula on earth. 10 years ago, or in 2016, Botox in the US or around the world account for about 4% increases to about 7 million. Now, in 10 years from then, in 2026, Botox would have reached 6.9 million US dollar. So the amount of treatment procedures using these neurotoxins will jump many, many folds. What is Botox? Actually, it is a purified protein derived from anaerobic gram-positive Clostridium botulinum bacterium. It has been used in medicine for over 50 years in the condition called strabismus. Strabismus actually is the squinting of eyes, either in one side or both the eyes, either is medial, lateral, or it can be inborn or acquired, and it involves the intraocular muscles and its nerves. It actually temporarily minimizes the effect of muscle activities, but it does not paralyze you. Its efficacy, its effectiveness can last only about 6 to 10 months. But each time when you do, the longer the efficacy is. This is how Botox look like in the market. Another neurotoxin that is very popular usually in Malaysia is Dysport, which is from Epson, UK, whereas Botox is from Elegant of United States. A small disclaimer, I do not have any relation, connection, or monetary gains from this company or product shown here, nor do I represent any one of them. I merely use this product as personal favorites. Now, why use Botox? Now, Botox has been used to treat patients for so many years. The, the treatment procedure is very simple. It has a very fast onset and a lasting result. The chemical denervation starts from 24 to 48 hours after injection. And the duration of effect lasts up to be 6 to 10 months, as I told you earlier. Botox or botulinum toxin is the number one prescribed toxin type A in the US. It has a long standing history of almost nearly 50 million procedures using this neurotoxin since 2022, when it was first approved by the FDA. And a survey has been done that 97% of patients who have been injected with this botulinum toxin are very satisfied. So it is the most popular physician-administered non-surgical aesthetic procedure for the past 30 over years. What is actually in a vial of Botox? In a vial of 100 units of Botox, it contains 100 units of Clostridium botulinum toxin type A neurotoxin complex. It contains 0.5 milligram of albumin human. It contains 0.9 milligram of sodium chloride in the vacuum dry form without any preservative. So if you see in the bottle of Botox, there's nothing inside except a very thin layer of whitish powder at the bottom, and it's vacuum packed. Now, what about in the Botox of the vial of this spot? It's slightly different. It contains Clostridium type A toxin 2 in either a 300 unit or 500 unit per vial. It contains albumin, 125 milligram, and it contains lactose, it's not sodium chloride, 2.5 milligrams. All these toxins should be kept within 8 to 2 to 8 degrees. And once it is open, and once it is mixed or reconstituted with normal saline, it can be used only up to 8 hours. Otherwise, the efficacy will start slowly diminish. The other newer neurotoxins are like Xeomin from Germany, which was approved in 2010. Juvor was approved by FDA in treatment of facial wrinkles in 2019. And the latest one is Neuronox. It was approved in last year, 2020. This is from Korea. All these different neurotoxins has their own efficacy. So now, what about botulism? Is it real or is it frequent? Actually, botulism is a very rare but potentially fatal illness caused by the toxin produced by this bacteria. The disease may begin with weakness, blurred vision, feeling tired, and even trouble speaking. And this may then be followed by weakness of the arm, chest, muscle, legs, vomiting, swelling abdomen, and diarrhea. So actually, there's no case so far documented that neurotoxin arrived from this either Botox or this what that cause botulisms, right? Now, what about death? As you heard, or you may have heard that in the past couple of years, there were 2 deaths, one in Singapore and one in Hong Kong. Now, according to Dr. Rachel Ho, she's a plastic aesthetic surgeon in April 2010, she said for a patient to suffer a cardiorespiratory failure after this injection of neurotoxin, 2 conditions have to be fulfilled. The botulinum toxin injected has to travel from the muscles to the heart and lungs. And the dosage of toxin injected has to be lethal enough to cause the heart and lungs to fail. Now, what is lethal dose? Lethal dose is 39 units per kg of body weight. For example, in an average person of 50 kg, so 50 times 39 is 1,950 units. That is about 20 bottles of 100 units of Botox. Very seldom we will use at one time for a patient more than 2 bottles. So it's very, very rare to cause these conditions. All right. And data has suggested that Botox has a very localized mode of action, meaning that when they correctly injected into the intended muscles, it has a very precise mode of action. A study has shown that the area of diffusion was approximately 2.4 to 6 centimeter only. So, right, Elegant has stated that it is not possible to detect Botox in the bloodstream if you inject directly in the bloodstream following this injection at that particular recommended dosage. So for any allergic reaction like anaphylaxis to develop, one condition must be met. The patients must have a prior exposure to this neurotoxin, whereby this allergic reaction would have already been known to patient or his or her doctor. I'll just give you an example of this picture. The top picture shows wrinkles or folds around between the eyes and the eyebrow. This area is called the glabella complex. So after it injects a few units of neurotoxins, it will smoothen out and even lift up the eyebrow. So how does botulinum toxin works? Actually, botulinum toxin, it blocks the release of acetylcholine at the presynaptic neuromuscular junction, leading to irreversible but temporary muscular paralysis and weakness. It does not cause a permanent damage to the nerve. All right. This is how it works. This is a schematic diagram to show that it actually blocks the release of acetylcholine that goes into the muscular junction area and cause the muscle to contract or elevate. Actions. Botox will only get rid of lines that are at 90 degrees to the muscle fibers. For example, the muscle fibers run this way. It only acts at 90 degrees. If the muscle is run in this way, it will not act. So when you inject Botox, the toxin has to go to where the intended muscle is. Okay. And the lines that is 90 degrees to this surface area, it will be sort of either elevated or depressed. And if it is a depressor muscle, if it is elevator muscle, it depresses. That means it relaxes. If it's the depressor muscle, it elevates or it stretches. This is how the Botox works directly on the muscles. Before any any procedure using neurotoxin or dermal fillers, we need to interview the patients, determine what their expectations are. As you know, dental patients are very they has a very high expectations of what they want, not only in the mouth but also elsewhere. So you have to tell them that therapeutic treatments will have aesthetic result as well, and patient must know this ahead of time before you start to inject. And very important thing is we need to take photographs, just like your dental procedures need to take photographs. And another one thing is informed consent, right? The informed consent has to be very precise and every detail has to be explained to the patient before you lift up your syringe. You have to sign in front of the witness. And you need to discuss with the patient the aftercare, that the patient should not lie down, should not rub, scratch, massage, whatever it is. And to let the patient know that the result will take up to 14 days to reach its full effect. Sometimes the patient the next day will call you, oh, nothing happened to me. What happened? So you need to tell the patient that the result will come as the time goes by. And you need to schedule the patient to come back after 2 weeks, just for a follow-up. And this is how we take photograph of patients either in static or in dynamic form, in animation form, to see which muscles give certain folds, wrinkles, any asymmetry or any abnormal uh, animations, right? These are the pictures to show what muscles give what during what expression that this muscle will give you that kind of line. For example, the occipital frontalis, the muscle on the forehead will give you a transverse lines. The coracoid muscle will give you the lines between the two eyebrows, and so on and so forth. Now, the neurotoxin that you use in dentistry are mainly from Elegant, that is Botox, and Dysport from Ipsen, that is from UK. Both these toxins are effective in many conditions, either in therapeutic or in cosmetic. And either one of them may give you the same results as well. Now, who should not receive these botulinum toxins? Patient with neuromuscular disorder, there is motor neuron disorder like the ALS, that is the amyotrophic lateral sclerosis, also known as the Charcot disease or motor neuron disease, where there is a muscle weakness, paralysis, loss of muscle control, twitching, eventually either speak, swallow, or breathe. You know, one of the famous example of this condition is Stephen Hawkins. I believe you remember who is he. The other condition that you should not give these toxins is myasthenia gravis. It is an autoimmune muscular disorder due to defect in the muscular junction, where there's a blocked prosynaptic neural receptors leading to muscle weaknesses and fragility. The other one is the Lambert-Eaton syndrome. It is another autoimmune muscle disorder affecting the postsynaptic acetylcholine receptor, causing the weakness of the limbs. And one of another condition that's very rare, I believe, I don't know anybody have come across, where I have seen one case, tardive dyskinesia. It is an involuntary, uncontrollable muscular movement of the face and jaw for a certain short period. Then there's certain blinkings and lip pulsing and smacking, eye twitching, and many things, which this thing you should not inject Botox because it's nothing to do with the muscles itself. Now, the therapeutic indications of Botox, especially in dentistry, is indicated for prevention, diagnosis, and temporary relief of facial pain. I'm sure many of you have patients coming to complain of certain pain on the face, right? And what do? The first thing that you see is open the mouth and look into to see if any dental caries or any ulcers and so on and so forth. But actually, that pain may not come within the oral cavity. You need to recognize that these pains may come from a certain aching muscles, right? You need to take a very good history of how the facial pain comes about, how often, what's the duration of pains, is there any muscle spasms that comes along with the pain, is there any joint sound that opening and closing the mouth, any limited jaw movement, jaw locking, any teeth grinding, either uh, voluntarily or involuntary, either day in the night or in the daytime, or does it accompanied by any headaches or any or one-sided head pain or something like that. So all these things add up to what we call facial pains, like sore jaw, tenderness or palpitations of the muscles, the joint sound, limited opening, uncomfortable bite, teeth grinding, and of course sometimes headache or migraine. Now, in 2010, October 2010, FDA, there's the Federal Drug Authority of US approved neurotoxin or Botox for the treatment of migraines. As you know, migraines is a uh, very uncomfortable conditions that can affect the patients. The definition of migraines are a distinct and severe neurological disorder characterized by patients who have a history of migraines and suffer headaches from 15 or more days per month with headache lasting 4 days, 4 hours a day or longer, every day for 15 days. That is a chronic migraine. So this neurotoxin or Botox helps to elevate, helps to reduce this migraine to a certain extent. And this is given about 3 months once until the condition subsides, right? What about clenching? I'm sure your patients, many of your patients come to your clinic say, sometimes you feel jaw uh, pain or jaw aching around the joint left or right or both sides. Either they clench inadvertently or they clench without knowing in the daytime, maybe due to certain factors, either psychological factors or whatever it is. Now, they have a survey done that 65 to 85 population in the world has some form of this clenching, which can lead to this temporary mandibular dysfunction. Okay? The causes of these TMD-related functions are clenching, bruxism, trauma, certain stress or tension, chronic illness, traumatic occlusion, muscular dysharmony, or even pathologic arthritic changes in the mouth too. Four basic forms of TMD are muscle pain, the joint sound, joint locking, and even the arthritis. But 85 to 90% of TMD problem is muscular in origins. Now, neurotoxin only works on muscles and nowhere else, right? So it only attacks only the muscles. Now, if the patient gets some relief from this neurotoxin, so it is muscle oriented. If the patient gets some relief, we need to add more neurotoxin. If the patient gets no relief at all from this neurotoxin, then TMD is not muscle related. But always remember, most of the facial muscles can give you facial pains, especially when patient come with a pain at the upper left molar area, right? And patient have this pain, and instantly you go start to check and to find out where this pain in, either intraorally or extraorally. But by right, actually the pain may have come or may have originated somewhere else. So this somewhere else point is what we call the trigger points, which is a sensitive nodules or hyperactive region that when it's been stimulated, it will cause a pain away from that muscles. For example, in this sensitive nodules here, if you see the at the angle of the jaw there, patient come with a pain there, but actually the trigger points is from the, the trapezius muscles at the back, right? Temporalis muscles, the pain may radiate to the central incisor, lateral incisor, or even radiates to the posterior segment of the teeth, or it may radiate to the back of at the ear there. Okay, what about the orbicularis muscles? Sometimes when the patients have a pain at the deep along the nose, if you press along the orbicularis muscle, the pain can radiate to the tip of the nose or even down to the upper lips. These are called the trigger points. The trigger points at the trapezius or sternocleidomastoid is when you press or poke or stimulate at the sternocleidomastoid, the pain may radiate to the back of the ear, to the angle of joint, angle of the jaw, or even at the occipital area. What are the therapeutic indication usage of this neurotoxin or Botox in dentistry? If you look at the label of the bottle, it is used in the parafunctional clenching, used in the painful jaw muscles, migraine headache, trismus, gummy smile, asymmetric smile, angular cheilitis, lip hypertonicity, mesenteric hypertrophy, bruxism, DAO muscles, especially in perio surgery, TMD, myofascial pains condition, facial pains, and even in aids in removable prosthetic retention, orthodontic to control any hyperactive mentalis. In those days, when patient come with bruxism in the night, we used to do these mouth guards. But now we have this neurotoxin to take care of it. Now, what about the cosmetic indications or the aesthetic indication of these neurotoxins? It can be used in the frontal or forehead lines, the frown lines, the crow's feet, the under eye lines, the body lines, the eyebrow lifting, the square angle of the jaw, necklace line, and the platysmal bands. These are the cosmetic usage of Botox. Remember that therapeutic injection sites are the same as cosmetic site, especially when the patient comes for a bruxism case. When you inject the muscles, so what muscle is this? This is the masseter muscles. The masseter muscles, it depresses. So when it inject, it relaxes. So when it relaxes, at the same time, it pulls the skin upwards. So it gives you that slimming effect. So this has to be made known to the patient that after injecting the masseter muscles for bruxism, the patient will have a slimmer face. This is a diagram to show you how the muscle acts. For example, the frontalis, the corrugators, procerus, and all the muscles around the face and the neck area. I'll give you an example. This is the frontalis muscles. When the patient lift up the eyebrow, you see a lot of lines, all right? We just inject a few units on the lines or in between the lines. And the size of these foreheads determines the amount of units that you can inject uh, on the patients. So this is before and after. All right, the larger the foreheads, the more Botox that you need to use. Okay, it's before, after. This is a before, after. You get a smooth forehead, right? All right, this is a before and after. The other areas where Botox are commonly used is the glabellar complex. Glabellar complex consists of four muscles. There is procerus, corrugators, depressor supercilii, the medial supercorrugator, and the lateral corrugator, and even the orbicularis oculi muscles. All right. So frown lines are created by the hyperfunctioning of these four muscular in nature. For example, these patients, they always have this, the H lines in between the eyebrow. So a few units of Botox can help to clear it. To clear at the same time, it also stretches the middle part of the eyebrow, and sometimes it may even make the eye look slightly wider apart. A few units on the procerus muscle, the middle corrugators, and the lateral corrugator muscles. This is before and after. All right, this is a serious case of a glabellar complex uh, muscles folds actually. So these conditions, you need to give more units of the Botox. Men normally requires higher doses than women. Right, crow feet. Crow feet is the repetition or rapid contraction of the orbicularis oculi muscles. After many years, then the folds will form lateral to the lateral canters of the eye. And normally this one will denote aging. As you grow old, the lines will start forming at the corner of the eyes. And the ladies definitely they hate this thing, For young people, it's very rare to see these conditions. A few units of Botox on the tail of the lines will sort of stretch the ocular muscles and thereby reducing these wrinkles. This is before, after, before, after. Sometimes lines form at the eyelid, below the eyelids, and this can be treated using a very little amount of Botox. All right, nasalis muscles or budding lines is caused by the contraction of the nasalis muscle. A few units of this Botox on these muscles will get rid of the lines. Now, what about gummy smile? I'm sure every dentist will come across these conditions. Gummy smiles, actually, it is because of the elevation of a muscle called levator labii superioris alegnesi. It is technically known as maxillary gingival excess, and actually is in the aesthetic concern to most patients, who display a lot of gingiva than the teeth and maxilla. Those days, we used to do aggressive procedures, surgeries, and whatnot. And nowadays, we don't do that, but we use this non-invasive, simple approach. That is injection of Botox into this muscle, the levator labii superioris alegnesi, which lift up the upper lips as well as the ala of the nose. All right, this patient, 2 units at the next to the ala of the nose, right? To the perpendicular to the thing. Okay. I'll show you a video. How is this done? To the thing is poked inside 6 mm. See that? Left with 2 mm left. Now inject 3 units. Okay. Other side. Actually, you can stand the thing, ask the patient to turn. Okay. Not too much. Relax, don't smile. No animations. Okay, no animation. Okay. Put inside. Okay. 3 units. All right. Right, gummy smile. There are few categories of gummy smile. Right, mild means 1 to 25% of the gum is shown. Moderate is 25 to 50. Advanced 50 to 100, and severe is more than 100%. Even without smiling, you can see the gingiva. I'll show you some cases. So my patients, this before after case. Before after. Right, this is a male patient. Before after. Another patient, before, after. Right, this is before, after, before, after. Now, what about the dosage? According to this Dr. Bob Khanna, if you treat with 2 units on either side, he will give you a lift. He give you a 6.4 millimeter of amount of the upper lip from lifting. If you treat 1 unit, you give him about 3.6 millimeter. That means if you give 2 units, it won't lift up so much, right? The lips will remain at that much to cover up the exposed gingiva. If it's less than 3 mm of exposed gingiva, when smiling, do not treat because it's quite normal sometimes to see a little bit of the gum, right? If it's more than 3 to 5 mm of gingiva exposed when smiling, then you can treat. Or if it's more than that, you can even treat it, but it has to be done in stages. Okay. Sometimes this neurotoxin can be combined with the what you do within the mouth. For example, after you have done a nice veneer, or sometimes the patient has these black holes or these spaces in between the teeth. So to cover all black spaces, you can inject some Botox so that the lips will come down and cover it, right? Mesenteric hypertrophy. And this is mostly due to either clenching, voluntary, or night grinding of teeth or bruxisms. And as the conditions progresses, the muscle become hypertrophic and becomes very thick on the other side. And this will give a kind of squarish shape to the patients, see, especially in girls or women, which they hate it very much. All right, those days we used to give mouth guard to prevent clenching of bruxism, but now we use this neurotoxin. Okay. Okay, now I want you to listen to this. This is how bruxism or grinding of teeth during a sleep. Okay, this recording is shared to me by a patient. It's very eerie, isn't it? So when we do masseter injections or bruxism, we used to jab at least about 20 to 40 units of Botox or either 40 to 80 units of D-spots on a few points on the masseter muscles. And it's a very simple procedure. We just have to poke it directly 90 degrees to the skin. And then, but at the same time, this procedure will give you a slimming effect like this. Right? You have to determine where the body of the masseter muscle is and where is the peak or the belly of the muscles, and we inject into that muscle. The thing just poke in full heart, slowly inject. You know that this is 10 units, so you just have to inject all inside. Okay? Now this is the peak of the belly. That means the, what do you call it? The highest point. Full heart and just go a little bit inside and then just slowly inject. Perpendicular to the skin, 90 degrees. Don't do that. Don't go any direction. Just perpendicularly inject. Same thing. This is a lower point. Go inside. Full heart. Slowly inject. Right. I'll show you some cases, but before and after case. Okay. Before and after, the patient have a slightly slimming effect. Okay. Before and after. Before, after. All right. It's one of my patients. Before, after. Before and after. The top one is before, the lower one is after. And sometimes patients do not have bruxism or clenching or any of these sorts, right? They just want to have a slimming face. So if you inject Botox over there, you will get some kind of a slimming effect. Now, what about the temporalis muscles? Temporalis muscle is one of the muscles that also aids in clenching or bruxisms. It is a fan-shaped muscles above the ear, right? So it's easy to palpate the muscles. You just ask the patient to clench and relax multiple times, and you can see your finger is moved laterally, you know. So you mark down over there, just 2 points, and give about 6 to 8 units of Botox. And this will help to relaxes the muscle. These are the few areas where you can inject the neurotoxins. Okay, on the face, neck, cheek, chin, everywhere, including the neck. Brow lift is another area where you can use Botox to elevate a little bit. As the patient grows old, especially the ladies, say 40 to 50, the eyebrows start to droop down, right? So in order to give her a little bit of lift, you just inject just a little bit of 2 units of Botox at the tail of the brow, and this will give you a lift. The drooping of the of the brow is because of the palpebral branch of the frontalis muscles. So it relaxes, it goes down. So when you give a Botox, it will elevate up a little bit. Now, Botox is very safe and effective way. You must have to remember that. But whatever it is, you need to understand which muscles you intend to inject. If you inject into the wrong muscles, so that muscle will work, and your muscle that you want to inject will not work. So you need to have the anatomy at your forefront, especially when you want to inject Botox. And always inform the patient that the therapeutic injection of Botox will give you some kind of cosmetic results at the same time. All right, now let's go to fillers or dermal fillers. Okay, uh, what create youthfulness? To certain people, youth is like that. Or to some people, or youth must be young and energetic, and so on and so forth. But all this it depends on how you go about, uh, how the patient want themselves to be. Men and women actually the same. Everyone want to have this look that is unique only to them. All right. For give example, look at these celebrities. Now, one on the left hand side is 20 years older than the one on the right hand side, but both of them looks youthful and beautiful. Right? Uh, we always want to achieve or maintain an inverted triangle of the facial features. But when the triangles turn the other way around, when you start to get old, it totally pull down the face, right? As you can see on the right hand side. So by using these products, the fillers, we can change the triangle from reverse on a from reverse triangle into from a triangle into a reverse form, but to a certain extent only, right? For example, look at this two-person, a daughter and a mother. One is 26, one is 64. On the right-hand side, the mother, everything droops down due to certain factors that cause this thing to look very old. Okay? This is another comparison of mother and daughter. Right? So which age the triangle of youth becomes overturned or inverted. There'll be drooping of the cheek area. There'll be skin, the cheek become flattened. There'll be sagging jaw lines, and then of course once these things start moving, there'll be fullness under the chin, what we call the double chin. Okay? Aging is a progressive thing which you can't change much. It is a progressive thing that everybody will undergo. But we using these products, it can sort of delay or retard these progressions. What if you could change or bring back the patient, what the patient have lost over time? But it takes actually some understanding and time and appropriate products to give you these results. But actually, it needs some practice and it needs some creative thinking, to achieve the result that the patient will like it and then you will want it to be. And also, you need to have a certain expectations to weigh the expectation what the patient expect. You cannot expect it to become what she wants. Actually, there's up to a certain limit. There is. Uh, our face is very proportionally balanced. The nose, the width of the nose is balanced with the eye, the eye, and from the corner of the eye to the ear is all imbalanced. But sometimes this do not happen, and because of this imbalance or asymmetry, so these products, these fillers comes into use where we can give the patient some kind of a symmetry. Okay. What about etiology of the aging face? There are two kinds. There is endogenous aging and exogenous. Endogenous aging is because of cell changes, cell dying, or cells cannot reproduce. And then there's even cell cannot repair when there's any damage. It may be due to hormones injection, hormone reductions in the under the skin, or maybe due to oxidative stress, mutation, loss of cutaneous, subcutaneous fat, muscle relaxing, and all that. And last but not least, loss of dental support. As you can see as a dentist, when the patient lost all the teeth, what happened to the lower third of the mouth? The whole lower third will be sunken, and it makes the patient look very old and 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 shrunken. You see, all right. So this is the endogenous cause of aging. The exogenous cause, of course, is UV irradiation, smoking, alcohol, gravitational pull, and all these things. And last but not least is the stress, psychological effect of it. Sometimes patients feel depressed. When the patient is depressed, they sort of the whole thing droops down, and this may cause the kind of aging process. What constitute uh, beauty, right? The female should have a large, smooth forehead and a small nose, round eyes, bigger, wider apart with prominent eyelashes, a heart-shaped tapered jaw, a plump vermilion border of the lips, all right, a waist to hip ratio of 0.7 and something like that. This is what a female beauty will look like, right? Now, what about male? Male should have an overhanging brow with deep set eyes and large nose, white white nose with mouth, large lower face and jaw, and of course a square lower face with muscular masseters. But sometimes this does not happen to everybody. This not it's not everybody could have this type of features. But the product that we're going to use can give you some kind of an enhancement for patients who want to look either feminine, or more masculine. Right? The ideal soft filler that we use in cosmetic and therapeutic uh, medicines should be safe. It should be non-immunogenic, non-carcinogenic, non-teratogenic. It should not cause any infection. It should be physiological, and then it should have a very low abuse potential. It should be give you a long-term effect. So when you inject a certain product or certain fillers into one area, it must stay there. It should not go elsewhere. It should give you a natural feeling. It should not give you the kind of lumps and bumps, hard lumps and bumps. And it must give you a result that patients are happy about. And the practical aspect of using this product is it should be easy to use. It has to be approved by the FDA or the MDA and so on. And it must able to be removed or reversed if it's required. It should have a long life, and then it should not be too expensive. Okay, this is a chart that shows where the areas where you can place your fillers in the periorbital lines, vermilion border, the perioral lines, smile lines, the oral commissure of the mouth, the lips enhancement, the jaw contouring, the chin, the pre-jaw area, nasolabial fold or the smile line, cheek augmentation, the tear trough that's under the eye, and so on. So what are the dermal fillers that frequently used, or what are the common dermal fillers that commonly used? Is the hyaluronic acid fillers, which is constitute mainly in the common dermal fillers that we use. Hyaluronic acid is a natural polysaccharide polymer that retains water, allowing for hydration, lubrication, and stabilization of the connective tissues. That means it is placed above the connective tissues. It provides a fluid matrix on which collagen and elastic fibers can develop. And HA or hyaluronic acid is chemically identical throughout species. And so with aging, as the patient grows older, this HA either decreases or depleted, resulting in the skin wrinkling and sunken. So the use of this HA helps you to temporarily replace the lost HA and to restore the skin volume as well as to smoothes certain creases or fold or wrinkles. The filler source that is like what we use in our dentistry, the bone graft. It can be autogenic, derived from dermis, fat, plasma, or even the fibroblast. The allogenic is derived from a cadaveric human being. It is cultured collagen, and it is cadaveric collagen in nature. The xenogenic is derived from bovine, porcine, or avian, or it may be bacterial collagen in nature. And they also have synthetic fillers, that is hydrocell, calcium hydroxyl apatite, polymetacrylate, dextran, silicon, etc. Whereas all these things can be used as a fillers, but to a certain level, and also in certain areas only. There are certain precautions to understand that if you use a synthetic, it is non-resorbable and it has a long standing of like granulation and so on and so forth. If you use a xenogenic, then there is a low risk of reaction or allergy. But if you use allogenic, there's high possibility of infection because it's from another cadaver. For autogenic source is very little to be obtained, and but it has no immune risk. Okay? These are the common fillers that we use or I use in my practice. The other from Juvidum, from a company called Elegant from US. We also produce the Botox, or it can be from other companies like Telxen and from Switzerland and so on and so forth. This is another filler material that is commonly used in Malaysia. It's from the company Telxen of Switzerland. Like neurotoxin, in between 2016 to 2027, then the usage or the amount of this filler used in the market has grown in multiple leaps, until and it is so commonly used that patients prefer to use this material than to go under surgery. Right. Now, before you embark on this treatment using HA, you have to be sure to go through your skin anatomy, understanding the different layers of the skin, the structure, etc. Because if you inject the fillers into a wrong layer, it may not give you a result, or it may give you an adverse results, a result that the patient will not like it, or it may give you some other kind of complications. So you need to know exactly where this type of fillers can fit into which layers under the skin, right? So that it will give you the desired result, and it will become more lasting and so on. But nevertheless, if sometimes it's not always perfectly precise that when you inject this material, it will go there. So in the event that you need to remove it, there is a certain chemical, a certain enzyme where you inject is to be dissolved this away. All right. So it's very important when you do injection of fillers. You need to understand where the blood vessels is, and that is to avoid them. Because it is a very high risk if you inject this filler into the blood vessels, right? It may cause very deadly consequences, right? For example, this schematic area, you see, this is the top part of the under the subdermis is the collagen molecules, and somewhere below in the mid dermis is the HA molecules. So in the young people, you have plenty of this. As you go old, all this collagen and hyaluronic acid will start to deplete or diminish in number. I'll give you an example of using dermal fillers in this picture. The nasolabial fold, the oral commissure, and the cheek. So on the left hand side is before, on the right hand side is the after. All right, this is another case, before and after. Slightly older lady, before and after nasolabial folds. This is the mild nasolabial lines. All right, just a little bit, some amount of fillers injected underneath the line. The wrinkle will lift up the line. What are the adverse events that can be associated with these HA fillers. The common one is erythema, swelling, edema, pain, tenderness at injection site, bruising, and itchings. Actually, fillers belong to the most frequently used beautifying product. They are generally well tolerated, but any one of them may occasionally produce adverse side effects. Adverse side effects usually last as long as the filler is in the skin, which means that short-lived fillers have short-term side effects, and permanent fillers, like the silicone that may induce a lifelong adverse effect. But the main goal is to prevent them. However, this is not always possible. So utmost care has to be given to the prevention of infection, and the injection technique has to be perfect. Uh, the rare cases of adverse reactions are like delayed local hypersensitivity to this HA, or granulomatous reactions. There may be swelling, abscess-like swelling. There may be arterial embolism if you inject directly into the artery. And there may be venous occlusion if you inject too much and it compresses on the veins and so on. Or there may be some acneiform eruptions, but these are very rare. For example, this necrosis around the skin, where it is injected too superficial, it may cause skin necrosis. But this can be treated using ASA, nitropase, and all this, even steroid too, right? Um, this is another adverse reaction due to allergy. We can be treated with steroids, antibiotics, antiviral, and so on. This is bruises, lumps, and actually bumps occur when the unsuitable fillers is injected superficially or in the wrong location, in the wrong level. But it may occur immediately, or it may develop after a few days due to some muscle activities. So to prevent this, either using a blunt cannula instead of sharp needles, so that it won't be inadvertently injected into the vessels. Um, where delayed adverse reaction may cause something like necrosis of the tip or the ala of the nose. All right, this is because of the compression of the lateral nasal artery. For example, this case, you see, it started with the black thing and then followed until it become necros, ulcers, and so on and so forth. But eventually, if once you determine the cause of this, and if you remove all the fillers that you injected, then patient may recover. There are many articles that is written about the risk of alar necrosis, But in conclusion, is alar necrosis with these fillers is very rare event. Proper technique and proper recognition of the risk factor may reduce the incidence of this complication. So physician or dentist should be aware of early intervention and treatment option should this necrosis become apparent. Right? Um, where there is a complications or any sign of evolving complication, the use of these enzymes called hyaluronidase is recommended. This hyaluronidase has a certain place in the removal or resolving this HA in the area where you injected. It breaks down these cleaving glycoside bonds of HA and then it sort of dissolve it away. Right? Many articles have been written on the use of hyaluronidase, but in conclusion is hyaluronidase has a place in the treatment of allergic reaction to hyaluronic acid in the erroneous misplacement of the material. Right? Some patients may react to this hyaluronidase, but patients should be informed about this before we inject hyaluronidase to remove the hyaluronic acids. This is some of the example of hyaluronidase that are available in the market. Whoever is practicing dermal fillers injection, they need to keep these enzymes or these hyaluronidase in their fridge. In the event that this adverse reaction occurs, instantly you need to inject this into the area. Okay. Another article, on avoiding dermal fillers complications is technique, knowledge, expertise with fillers, proper patient assessment, a well-formulated treatment plan with access to agents for superficial, moderate, and deep bright types, and volume restoration provide the necessary ingredients for optimum soft tissue augmentation with while minimizing complications. This is obtained from the clinics in dermatology. Okay. Now, we need to make the patient understand the limitation of these treatment modalities. Not every injection will give the same results, and not every patient will obtain the same result as well. You need to weigh a perfect outcome for each and every patient, right? Some, especially on the risk and benefit that the patient needs to know. They need to give an informed consent that this material sometimes may give you certain complications. And then on the dentist side, you need to use the correct filler for the correct situations. All right, and you need to use the correct technique, the correct depth where you need to inject. Otherwise, you will not have a perfect balance. Now, the therapeutic dermal fillers in dentistry are used in eliminating black triangles in between the teeth we are showing just now. They can use to treat angular cheilitis, post-gummy smile, asymmetric smiles, asymmetric lips, lip deficiencies, and even in orthodontic soft tissue profiling. Black triangles, all right, I'm sure all of you have come across these cases, is otherwise known as the deficient interdental papilla. All right, it occurs between the teeth, especially after orthodontic treatments. All right, just a little bit of dermal fillers injected into the base of the papilla will give you an extended papilla to cover at least part of the triangles. And it's a very simple procedure, just some topical anesthesia around the area, and you inject directly into the base of the papilla. And then you need to knead it down to the apex of it. Is the before and after. Okay. Angular cheilitis. Angular cheilitis, though, is very rare, but it can be treated with fillers as well as Botox. Okay, 2 units of Botox injected into the depressor angular oris muscle to reduce the depressing of the depressed angular oris muscle, so it elevates the muscles. This is where you inject at the depressed angular oris muscles. This is a case of angular cheilitis before and after. While after you inject on the DAO, the patient will have a little bit of uplift of the corner of the mouth, which makes her looks a bit smiley. Right? Combination of Botox and fillers before and after. Sometimes fillers can be injected at the lower corner of the mouth to lift up the corner of the mouth. Or there's another method to inject the fillers. Marionette lines. Marionette lines are lines that forms at the corner of the mouth towards the base of the mandible, especially during actually when the patients become older. So this you need to combine it with Botox and fillers. Smoker lines, water bottles lines that forms on the upper lips. Chin augmentation before and after. Some patients may have pronectism, so you inject Botox directly on the chin. It will sort of push or protrude out the chin to complement the rest of the face. Though it's not permanent, but it looks better than a short chin. All right, this is my patient before and after. This is after an orthodontic treatment, before and after. Now, what about lips? Now, lips is a very sensitive issues. The therapeutic usage of lip augmentation using fillers are asymmetric lips, post gummy smile treatment, gummy smile, and even in lips deficiencies. For example, these are the before-after cases. Asymmetry lips before, after. This is my patient before, after. Immediately you can see the results, and after about 2 weeks the result be more enhanced. Before, after. The cosmetic enhancement using fillers are actually very sensitive. It requires a little bit of an artistic creativity of the injector, but not everybody will want the same results. All right, it depends on individual. So as a dentist, when we do lips enhancement and lip augmentation, we always go slow. We inject the minimum, and if it's not enough, then only we add on after a week or 2 weeks later. Just like our teeth, we have different shapes. So does the lips too. Okay. To understand and to augment lips, we need to understand that different gender or different race or different type of people will have certain type of lips. So not every lips will fit anybody. For example, a Caucasian and a Negroid. For example, you see a Caucasians, the upper lip is smaller or thinner than the lower lip, whereas for a Negroid, up and down looks the same. Right? There are a few types of lips that you need to understand if you're going to lip augmentation. And the typical one is lips that has 1:1.618 ratio, and they also have the Rubina lips, the Cupid lip, the Perlick, Hollywood, and the Angelina Jolie lips. Right? See this example of lips augmentation, static and some smiling. So to understand how lips go about, you need a lot of experience and a lot of know-how, where certain products, certain fillers will only give you that result that can be obtained. But if the patient needs slightly more voluminous, for example, then you need to give the patients a little more firmer uh, product, a firmer fillers that can stay there for longer times. It's very technique sensitive, and actually it require combinations of what you do inside the mouth, the teeth and all that, to also complement the uplift of the lips as well as the product that you're going to use. Now remember symmetry and do not overinflate. I'm sure you have heard of many beauticians or many other people who have done that thing. They want to show the patient that this is the result instantly, right? So actually, as dentists, we are very conservative. We inject little so that we do not over inject. If you over inject, then you need to remove it, because as you know, dermal fillers, hyaluronic acid is hydrophilic. It absorbs water after a certain number of days, and we give it more volume. Right? Dermal fillers and Botox can be used in combination with dentistry together. For example, this picture shows, to complement the beauty of the veneers that you've done, right? You can complement that with giving the patient that extra volume or the extra conspicuously of the lips, especially the upper lips, the vermilion border, and so on and so forth, especially in ladies. Okay? And what you have done in the mouth, if the lips are not symmetrical, then is still will not, the patient will not look nice as a whole. So this thing you need to give the patient more than what you're doing within the mouth. That is, give the patient that symmetrical lips to complement your dental procedures. All right. Um, Fillers can be used to augment the jawline. As you grow old, the jawline becomes like very bulbous or looking very fatty. So by injecting fillers into that jawline there, it helps to elevate and redefine the line, right? Before and after. In male patients, before and after. The current regulations on cosmetic interventions, just to let you know, like if we use toxin, is a product, is a prescription product or under prescription medicine, uh, can be prescribed, it can be prescribed, but can only be prescribed, but can be only administered also by a non-health professional like nurses and so on and so on. And where can you give this toxin? Is can give anywhere, either in the dental practice and so on and so forth. About fillers, it must be approved by the the authority like the FDA and so on. Uh, it can be performed by anyone, including nurses, and it can be injected anywhere like in hospital, in clinics setting. What about the risks and complication? The risk of toxins are, of course, like bleeding, unintended muscle weakness, eyelid drooping, double vision, speech difficulty in breathing, and so on and so forth. For fillers, of course, it's very rare. The only complication that can arise may be infection at the injection point, scarring, inflammation, pain, asymmetry, tissue loss, or even sometimes some visual or some disturbance. Okay? Now, there's certain guideline that we must do when you're using neurotoxin and dermal filler for a patient. You need to stay safe. That means every time when you want to poke a needle into the patient's face, right, you need to keep the patient's anatomy at the forefront. That means your anatomy of the area where you're going to do has to be very clear as you go along, as you poke into the skin, right? You must be make sure that the patient feel comfortable, all right, and do not come with a needle in front of the patients. And already patients when they come to dentist, they are so scared of needles. So you have to be very aware that needles make them feel scared, all right? And always stay subtle. You always aim to enhance the patient's beauty, but we do not change how they look. It's just like you can turn back the clock, but don't give the clock a new face. You know. What about regulations? Now, if you look at the GDC, the General Dental Council of UK, they have come up with this red book, maintaining a standard. It says that registered dentists are identified as appropriate practitioner and are permitted under Section 58 bracket 2 of the Medicine Act to procure, prescribe, dispense, or administer prescription-only medicine in connection with practice and medicine. So POM, prescription-only medicine, like botulinums, is of course one of the such medicines. All right. They come out in May 2010, a dental team working on this procedure. It states that registrant choosing to offer Botox or other non-surgical cosmetic procedures should note that the GDC expect the same high standard of them, whatever the type of treatment they are carrying out. In particular, they are advised to work within their knowledge and professional competence and be prepared to back up the decision they make. Careful thoughts also needs to be given to maintaining professional standards in relation to advertising their services and to the need to be identified. In August 2010, in Arizona State, US, says that dentists can administer Botox and dermal fillers as long as it is part of a dental treatment plan. So a dentist may inject pharmacological agents such as botulinum toxin, type A, or dermal fillers as supportive therapy in conjunction with the dental treatment plan consistent with the scope of practice of dentistry. Our neighbor, the Singapore Dental Council, in June 2013 states that these procedures become the practice of dentistry when carried out by a registered dentist, and then providing detailed guidance on which procedure could be carried out by registered dentists and oral and maxillofacial surgeons. So the SDC has set up an aesthetic facial procedure oversight committee for dentistry, which is itself assessing the nature and quality of any training received, and then they issue a certificate of competence where appropriate. What about Malaysian Dental Council? I'm sure many of you have this in your mind. Well, at the moment, it's still a question mark, but we are still in the process of obtaining the approval, including facial aesthetic, into the Dental Act. A couple of years ago, we formed an association called MOTA, M-O-T-A-A, Malaysian Orofacial Therapeutic Aesthetic Association. We're going to use this platform to engage the MDC on these treatment modalities for dentists in Malaysia to practice, just like our Singapore counterpart. So actually, it will come one day. Now, it's because of the pandemic, this is put on hold. In the meantime, there is no regulation, rules, or law that prohibit the practice or usage of this product for your patient, as long as they complement your usual dental treatment modalities and they are for your patient as a whole. What does the future hold for using these products in dentistry? Now, the use of these botulinum toxin products in TNT therapy can give us a totally new insight as to helping this patient who have had a lot of trouble getting relief before. Many times as we dentists have developed a tunnel visions, and believe that just by fixing the dentition, it will solve all the other problems. So as a dentist, we need to open our vision wider. Many dentists completely ignore the fact that the muscle themselves may be in spasm, and the need to relieve in order to allow us to achieve this right occlusal equilibration, an endpoint for our full mouth reconstruction. So in other words, what we are doing inside the mouth is not the end of it. All right, what constitute a pain, for example, a facial pain, it needs to be related to other areas, and that's where this neurotoxin and dermal fillers comes in. So it seems like the use of fillers and toxin by dental practitioners will increase in the years ahead. A thorough understanding of the technique, appropriate training from a reputable and authoritative source, and an awareness of the risks and how to manage them effectively, including having adequate and appropriate professional indemnity, is no less important for facial aesthetic procedure than for conventional dentistry. Rajiv Grover is the president of BAAPS. BAAPS is the British Association of Aesthetic Plasticians, says that measures should be in place not just to ensure that practitioners are better trained, but to ensure that aesthetic treatments that involve a medical procedure such as injecting dermal fillers are only performed by those who have full training. Aesthetic injectables should only ever be provided by medical dental professionals, as dermal fillers have clear benefit but also risks. It's not just about who can weld a syringe, but who will have the capability to deal with any possible complications. Right? So this is, ladies and gentlemen, this is about all that I would like to share with you, that these neurotoxin dermal fillers procedures are coming.